Hello, everybody.
Good afternoon, ma'am. Good afternoon, ma'am.
Welcome to our institute. Welcome.
Yes.
So, already spinal cord and medulla oblongata is done. So, we are going gradually up and up. Okay. So, above the medulla oblongata is the pons. The pons, it is a Latin term. It means bridge. And it is also known as Pons Varolii, that means the bridge of Varolii. So there is one anatomist and a surgeon, because that is in 16th century, who that time who did the surgery. They are also teach the anatomy also. Okay. So that is Costanzo Varolii. Costanzo Varolii from Italy. So he described the pons. He described the pons as a bridge connecting the
Varolii.
cerebellum. Okay, is it clear? Now you can see that the green area here is the pons. It is a prominence just above the medulla, and its length is about 1 inch. And then you can see that it is connected with the cerebellum by a peduncle that is known as the middle cerebellar peduncle. On both sides it is connected. This is the lateral view, and you can see one nerve is coming out from the pons at the junction of that prominence and the middle cerebellar peduncle, and that is known as the trigeminal nerve. This is the thickest nerve, cranial nerve in the body. So that is known as the trigeminal nerve is coming out. Okay, so that is known as the bridge of Varolii or the pons Varolii. Okay, now that pons, it is above the medulla oblongata, and there is a pontomedullary junction. You can see various nerves are coming out from that, and this is the pons. So the pons, this is the ventral surface of the pons. It has a dorsal surface also, and this is the trigeminal nerve. This is the middle cerebellar peduncle. Above it is continuous with the midbrain. So this is the anterior aspect of the midbrain, that is the crus cerebri, that is anterior aspect of the midbrain. So this is the ventral surface of the pons. And in the ventral surface of the pons, there is a groove in the midline that is known as the basilar groove. And the vertebral artery, you know that the vertebral artery is coming through the foramen magnum, and they join with each other at the pontomedullary junction and form a single artery that is known as the basilar artery, which runs in this groove. So this groove is known as the basilar groove. So the branches of this basilar artery will supply the pons. Now this is the lateral section or cut section, mid sagittal section, and you can see that the posterior surface behind the pons, there is a ventricle, that is the fourth ventricle, which separates the pons from the cerebellum. So this is the fourth ventricle, and here you can see the internal features of the pons. The anterior part of the pons is known as the basilar part. This is the basilar part, and the posterior part is known as the tegmental part of the pons. Okay. Now you see the posterior surface. So here you can see that the posterior surface, it forms the floor of the fourth ventricle, the floor of the fourth ventricle. So this is the dorsal surface of the pons, where you can see that there are some fibers here which is going from the medial side to the lateral side. These are known as the stria medullaris. Stria medullaris fibers, and they separate the posterior surface of the pons from the posterior surface of the medulla. And in the pons, this is the floor of the upper part of the floor of the fourth ventricle. Here there is a midline sulcus, and surrounding that there are two eminences. That is, this is the eminence, medial eminence. The lower part of it is formed by a nucleus and also by the nerve of the facial nerve fibers. So that eminence is known as the facial colliculus. Okay, so that is the dorsal surface of the pons. Now if we see the internal features of the pons, you can get that I have already told you that anteriorly, that is the basilar part. Here this is the basilar part, and posteriorly that is the tegmentum or tegmental part. In the tegmental part, So C and D, these are both are in the tegmental part. Here the C, there are some transverse fibers, they will form the trapezoid body. I will come to that later on. This is the posterior surface of the pons, and this is the fourth ventricle, and this is the middle cerebellar peduncle. Okay, now in the basilar part of the pons, you can see that there are various transverse fibers are present. Also the vertical fibers are present, and also some gray nuclei are present. These gray nuclei are known as the Pontine nuclei, and the vertical fibers, they are the pyramidal fibers, and the horizontal fibers are known as the pontocerebellar fibers. So these pyramidal fibers, they come from the cerebral cortex. They contain the cortico-spinal fibers, the corticonuclear fibers, as well as the corticopontine fibers. Now these corticopontine fibers, they relay in the pontine nuclei, and after relaying, the axons of these pontine nuclei, they cross the midline and they entered into the middle cerebellar peduncle of the opposite side to go to the cerebellum. So here this middle cerebellar peduncle, it contains the pontocerebellar fibers, which are actually the pyramidal fibers coming from the cerebral cortex, and they are relaying in the pontine nuclei present in the pons, and then they go to the opposite sided middle cerebellar peduncle. So these fibers mainly connect the cortex to the cerebellum, cerebral cortex to the cerebellum through the pons, isn't it? So that is the middle cerebellar peduncle. So the basilar part of the pons, it contains the vertical fibers, the pontine nuclei, and the horizontal fibers. The vertical fibers are mainly the pyramidal fibers, and they are corticospinal fibers, corticonuclear fibers or corticobulbar fibers, they can also be called as corticobulbar fibers, and corticopontine fibers. Pontine nuclei also they are present, these are the grey matter, and the horizontal fibers, that is the pontocerebellar fibers. Is it clear? Now the tegmental part of the pons. So this is the mid-sagittal section of the brain stem. Here this is the medulla, and the ventral part of the pons is known as the basilar part, which is continuous with the pyramid of the medulla, and behind the basilar part is the tegmentum, which is continuous with the posterior part of the medulla behind the pyramid, and above it is continuous with the tegmentum of the midbrain. Behind the tegmentum is the fourth ventricle. Okay, so if we want to see the inferior structure, that is the structure of the tegmentum, the structure of the tegmentum, some nuclei are present in the lower part of the pons, some nuclei are present in the upper part of the pons. So these nuclei are elongated structure, and the pons, you know, the length of the pons is 2.5 centimeter, but these nuclei are shorter than that length. They are half. Their length is half of that of the pons. So some nuclei, they are situated in the lower part of the pons, some nuclei are situated in the upper part of the pons. To see all these nuclei, we have to take the section in the lower part as well as in the upper part. So I will tell you what structures are present in the lower part of the pons and what structures are present in the upper part of the pons. And also in this tegmentum, there are the sensory fibers will also go from the spinal cord to the cortex or to the thalamus, and also some descending fibers also. These are the pyramidal fibers, they also pass. Extra pyramidal fibers, they are not the pyramidal fibers, okay, they are extra pyramidal fibers. Pyramidal fibers will pass through the basilar part, but the extra pyramidal fibers, that is coming from the midbrain or from the other areas, so these fibers, they will pass through they will descend through the tegmentum. Okay, so there are cranial nerve nuclei, as well as there are some ascending and descending tracts are present in the tegmentum, and also very important structures is present in the pons, that is the reticular nuclei. The reticular nuclei are only present in the brain stem region. Okay, some reticular nuclei are also present in the thalamus, but mainly they are present in the brainstem region. So in the pons also there are many reticular nuclei are present, but most important of them is the respiratory nuclei. There are two respiratory nuclei. I am coming to that. So what are the structures present in the pons? That is the most important. Though we will not describe very much about this reticular nuclei, but they are the most important because the respiratory centers are present in this nuclei. Though the respiratory centers are also present in the medulla oblongata, but some other respiratory center, like in the upper part of the pons, that is the pneumotaxic center is present in the reticular nuclei, parabrachial nucleus, some other nucleus, they are named also. So that pneumotaxic centers, they control the rate of the respiration. Okay, and the character of the respiration, pattern of the respiration is dependent on this pneumotaxic center. Similarly, in the lower part, there is another center, respiratory center, which stimulates, which excites the inspiratory center present in the medulla, that is known as the apneustic center. So these two centers are present in the pons. These are the respiratory center. There are 4 respiratory center, I think. Now the cranial nerve nuclei, some nuclei like the cranial 6th nerve nucleus, motor nucleus of the 6th nerve, motor nucleus of the 7th nerve, the sensory nucleus, that is the vestibular nuclei and the cochlear nuclei, salivatory nucleus, lacrimatory nucleus. So they are present in the lower part of the pons. And the sensory nucleus of the 5th nerve is also present in the lower part of the pons. But the motor nucleus of the trigeminal nerve, that is present in the upper part of the pons. Also there are other nuclei are present in the tegmentum of the pons, like superior olivary nucleus. Like in the medulla you have read about the inferior olivary nucleus. So here there is another olivary nucleus, but it is not so big, it is very small. This nucleus is mainly related to hearing, and our hearing is less advanced than that of these other mammals, like in the dogs or in the tigers or in the lions. They have a large superior olivary nucleus. Okay, but in our case the superior olivary nucleus is very small. Okay, so some nuclei or other nuclei are also present in the tegmentum. And most of the longitudinal tract, they are mostly the sensory tract, and some descending tracts like the extrapyramidal tracts, they are present here. Now, to see the pons, internal structure of the pons, we have to take the 2 sections, one at the lower level, that is at the level of the facial colliculus, one at the upper level, that is at the level of the trigeminal nerve. Okay. Now first section, that is through the lower part of the pons. So here we will get many nuclei. So one nuclei this is the abducent nucleus. Abducent nucleus, just on the ventral to the floor of the 4th ventricle. Okay, so this is the 4th ventricle. Here the abducent nucleus is present, and abducent nucleus, it gives its action, it supplies the lateral rectus muscle, isn't it? So its nerve fibers, they pass through the whole thickness of the pons, and ultimately they are coming out. They are coming out at a lower level, that is at the level of the pontomedullary junction between the pyramid and the lower border of the pons. So that is the abducent nucleus. Then another nucleus, this one, that blue one, that is known as the facial nerve nucleus. The facial nerve nucleus. Now facial nerve nucleus, you can see that the axon of the facial nerve nucleus, it has taken a very tortuous course, a very complicated course, isn't it? And why this complicated course is there? There is a theory. There is a theory of neurobiotaxis. And in that theory, it has been said that this facial nucleus is actually situated on the dorsal position. But the nucleus tractus solitarius, which is present in the medulla oblongata, they influence, they give some stimulation to the facial nerve, so they come down. Also, they were present on the dorsal aspect, but they come to the ventral aspect by some stimulation from the pyramidal fibers. So, they were situated here, but they come ventrally and also at a lower level. And as they come down, their axon is elongated. Their axon is elongated, and these axon ultimately come out from the pons at its lower border, between the olive and the lower border of the pons. So this is the facial nerve nucleus. Now it is situated ventral to the abducent nerve nucleus, and its axon, it is passing medial and then superior to this abducent nerve nucleus, and then it is coming out like this way. So that is the facial nerve nucleus, motor nucleus of the facial nerve. Both these nuclei are the motor nucleus of the facial nerve, 6th and 7th nerve. The vestibular nuclei are also present over the inferior cerebellar peduncle, and that is also present in the lateral part of the pons, medulla oblongata. So it is a very big nucleus, and it has 4 parts. The superior part, lateral part, medial part, and inferior part. The medial part and inferior part, they are mainly present in the medulla, and the superior part and the lateral part, they are present in the pons. The cochlear nuclei are also present in the pons over the inferior cerebellar peduncle. The dorsal cochlear nucleus, it is present over the dorsal aspect of the inferior cerebellar peduncle and forms an elevation here, and that is known as the auditory tubercle. Auditory tubercle. And the ventral cochlear nucleus, it is ventrolaterally present. Okay. That is the ventral cochlear nucleus. Also, the superior olivary nucleus. Where it is? The superior olivary nucleus. This is the, I think they have made it, that is the superior olivary nucleus. Okay, this is the superior olivary nucleus. Also the superior and inferior salivatory nucleus and the lacrimatory nucleus, they are also present here. These are the parasympathetic nuclei, and here that is in the lowermost part, so that is they have shown the inferior salivatory nucleus, but at a slightly higher level in that same position the superior salivatory and the lacrimatory nucleus are present. So they are parasympathetic nucleus, this inferior salivatory nucleus that give secretomotor fibers through the glossopharyngeal nerve, and it will supply the parotid gland. Okay, inferior salivatory nucleus. The superior salivatory nucleus, which is present slightly at an upper level, and that will give the fibers through the facial nerve, and that will supply the secretomotor branch to the submandibular and the sublingual gland, as well as to the lacrimal gland. So there are lacrimatory nucleus and the superior salivatory nucleus. They are sending their fibers through the facial nerve. Now, any other nucleus is there? Also, you can see there are some nuclei are present. These are not the reticular nucleus. There are some transverse fibers are also present here. That these transverse fibers, these are the crossing auditory fibers actually, and they are known, they form a body just behind the basilar part, that is known as the trapezoid body. And in these fibers, transverse fibers, there are some nuclei are present. They are known as the nuclei of the trapezoid body. Okay, nuclei of the trapezoid body. Also you can see one nucleus here, green color, and that is the principal sensory nucleus of the trigeminal nerve. So in the medulla oblongata, there is spinal nucleus of the trigeminal nerve is present, and that spinal nucleus of the trigeminal nerve, it is very long, very long. It is present in the spinal cord as well as in the, what is that, in the medulla oblongata. It is present in the pons, it is present also in the midbrain. So in the different region, it has got different name. So in the medulla oblongata, it is known as the spinal nucleus, and along with the fibers which are entering, this is a sensory nucleus, so the fibers will enter. So this is the nerve fibers of the trigeminal nerve actually. they will enter, and in the spinal nucleus of the trigeminal nerve that is present in the medulla, it is continuous in the pons as the principal sensory nucleus of the trigeminal nerve. Okay, so they carry the fibers the fibers which entering it, that will carry the pain and temperature sensation from the face, and in the pons they will also carry the touch sensation from the face. And when it goes to the midbrain, that is known as the mesencephalic nucleus of the trigeminal nerve, that will carry the proprioceptive sensation of the trigeminal nerve. So here we are getting the principal sensory nucleus of the trigeminal nerve. So these are the nuclei. Many nuclei are present here. Now some fibers are there. They are also the ascending and descending fibers. These are that is the medial longitudinal fasciculus, where the ascending and descending fibers are going, and they are connecting various cranial nerve nuclei with each other. So that is known as the medial longitudinal fasciculus, most dorsally. Ventral to that, there is the tectospinal tract, that is come from the superior colliculus to the spinal cord. So that is the descending fibers, and that is extra pyramidal fibers, motor fibers. Descending fibers are all motor. So they are the extra pyramidal fibers. Similarly, the rubrospinal fibers, that is also coming from the red nucleus of the midbrain, and that is also extra pyramidal fibers. Another fibers, there is also ascending and descending fibers are there. That is known as the central tegmental tract. So central tegmental tract, there are some fibers which are ascending, that is coming from the tractus solitarius, upper part of the tractus solitarius, that is the taste fibers. So taste fibers are going through the central tegmental tract upwards, and the descending fibers come from the red nucleus. So the red nucleus, and they go to the medulla, to the inferior olivary nucleus. From the inferior olivary nucleus, they will go to the cerebellum, isn't it? Through the inferior cerebellar peduncle. Okay, so that is also the main one of the connection that is connecting the cortex to the cerebrum to the cerebellum. So these fibers are coming, passing not from the cerebrum, that is from the red nucleus they are coming. So red nucleus to the inferior olivary nucleus, and then to the through the inferior cerebellar peduncle they enter into the cerebellum. Okay, so that is the central tegmental tract. Now this picture is very important for you, because during the diagram sometimes they have draw a diagram of the lower part of the pons at the level of the facial colliculus. So you have to remember, not this picture, whatever pictures you have in your textbook, you have to remember that. Okay, now so the tracts already I have told you. What are the tracts? Medial longitudinal fasciculus, tectospinal tract in front of that, rubrospinal tract in frontolateral to that, ventral spinocerebellar tract. I have not told you. So the ventral, there are two spinocerebellar tracts which are sensory tracts. That is the lateral spinothalamic tract and the anterior spinothalamic tract. So here they have shown the anterior spinothalamic tract. Here they have shown the lateral spinothalamic tract, which ultimately form the lateral lemniscus. I will come to that later. So this is the lateral spinothalamic tract. This is the anterior spinothalamic tract. Also the ventral spinocerebellar tract, that is also going to the cerebellum. And what about the dorsal spinocerebellar tract? It is not here. It is passing already to the cerebellum through the inferior cerebellar peduncle. So from the medulla, this posterior spinocerebellar tract that passes through the inferior cerebellar peduncle to the cerebellum. Okay, so all these tracts are present here, and in the pons, these tracts they will form the lemnisci. So these lemnisci, there are four lemniscus: the medial lemniscus, trigeminal lemniscus, spinal lemniscus, and lateral lemniscus from medial to lateral side. from medial to lateral side. They are medial lemniscus, trigeminal lemniscus, spinal lemniscus, and lateral lemniscus. How these medial lemniscus are formed? These are crossed fibers. They are formed by the fibers from the fasciculus gracilis and fasciculus cuneatus. So these fibers in the medulla, they are situated in the medulla, these nuclei, the nucleus fasciculus and the nucleus gracilis. So from there these fibers will come and they will cross and then they ascend. So when they ascend, these fibers, they are known as the medial lemniscus. So the internal arcuate fibers coming from the fasciculus gracilis and fasciculus cuneatus, and they cross and then they ascend as medial lemniscus. So that is most medial. What is trigeminal lemniscus? So this lemniscus, these fibers are coming from the trigeminal nucleus, sensory nucleus of the trigeminal nerve. So this nucleus, they receive the pain and temperature sensation from the face, and also in the pons, the touch sensation and also the proprioceptive sensation. So these sensation, they are situated just lateral to the medial lemniscus and ascend up to the thalamus. There they will relay. And what is spinal lemniscus? That is the lateral spinothalamic tract and the anterior spinothalamic tract. They cross and they ascend upwards to the thalamus as the spinal lemniscus. Similarly, the lateral lemniscus, what are they? These are the auditory fibers. So auditory fibers, from where they will come? They will come from the cochlear nucleus, from the dorsal cochlear and ventral cochlear nucleus, and then they cross, they form the trapezoid body, and then they ascend, and that is known as the lateral lemniscus. Lemniscus means ribbon. Ribbon means tract. Okay, central tegmental tract, I have already told you. So here, this is the medial lemniscus, that is formed by the internal arcuate fibers, and they cross and they form the medial lemniscus. Here is the trigeminal lemniscus, then the spinal lemniscus, then the lateral lemniscus. Okay, so medial to lateral, they will form a band. Okay, now we will come to another section, that is at the upper level, that is at the level of the trigeminal nerve. So here all these structures are present. The medial longitudinal bundle, it was present in the lower part. It is also present in the upper part. The tectospinal tract present in the lower part. Here also, lumbrospinal tract also, central tegmental tract also. So what is this? It was not present in the lower part. This is the motor nucleus of the trigeminal nerve. It is present here in the upper part of the pons. And what is this? It was present in the lower part. It was the sensory nucleus of the trigeminal nerve. But what is this? This is not the middle peduncle. It is the superior cerebellar peduncle. And through the superior cerebellar peduncle, which tract will go? The ventral spinothalamic tract. The ventral spinothalamic tract. Where is the sixth nerve nucleus and seventh nerve nucleus? Not present, because they are short. They are short. They are present in the lower part only. Okay, and the sensory nucleus of the trigeminal nerve is very long, so it is present here. The lemnisci are all present here. What is this? The medial lemniscus, the trigeminal lemniscus, the spinal lemniscus, and the lateral lemniscus. All are present. And what is this? This is the superior olivary nucleus. It is present in the lower part as well as in the upper part. This is the basilar part of the pons, which is present in the lower part as well as in the upper part of the pons. This is the upper part. So they have shown that the fourth ventricle, and here will be the cerebellum. The cerebellum is in the posterior aspect. Now come to the ascending the auditory pathway. Auditory pathway. Okay, so they are not here. Auditory pathway. Now here, the auditory pathway, what is the function of the auditory pathway? We can perceive the sound wave, isn't it? We can perceive the sound sensation to the cortex. So this sound wave, which is a mechanical wave that will enter through our ear, and then they pass through the external auditory meatus. What is this? This is the tympanic membrane. They give a push to the tympanic membrane, and tympanic membrane will vibrate. And when the tympanic membrane will vibrate, then in the middle ear there are 3 ossicles, they will also vibrate, and ultimately it will go from the stapes to the internal ear, and in the internal ear there are liquids are present. So this is the internal ear or cochlea. So here we have taken that section of the cochlea. So there are liquids are present. One is the cavity, the scala vestibuli, that is the perilymph, and here this the foot of the stapes, they will push it through the oval window, and there will be some vibration, and there is one membrane is present, that is known as the basilar membrane, that will also vibrate, and over that the hair cells are present. They are sensory cells. They are not like hair, they are sensory cells, and they will also vibrate, and there is depolarization. So now the mechanical conduction is converted into nervous conduction. Okay, so there is depolarization, and then that signal, that nervous signal, that will pass through the nerve fibers which is coming from these hair cells, and they will relay in the spiral ganglion, or that what is that called, the spiral ganglion of Corti, organ of Corti. So this is the organ of Corti, this is the spiral ganglion. So they will relay there. These are the bipolar nerve cells, and from there the fibers will come out as the cochlear nerve, and the cochlear nerve goes towards the pontomedullary junction. Okay, now this is the inner aspect of the brain, cranial fossa. Now here there is a bone that is known as the petrous part of the temporal bone. This petrous part of the temporal bone, it contains inside, it is hollow, it contains the inner ear. It contains the inner ear, that is the cochlea and the vestibule, and also the middle ear also. Okay, now that inner ear, from the inner ear, the cochlea, now there is an opening that is known as the internal acoustic meatus. Okay, here this is the internal acoustic meatus. So from that internal acoustic meatus, the vestibular nerve as well as the cochlear nerve, they will come out. Also the facial nerve and the vestibulocochlear nerve, they will also come out. Now this is the foramen magnum. Just in front of it there is an area, and in that area the pons and medulla is situated. So pons here and the medulla, then it is continuous with the spinal cord. So this vestibulocochlear nerve, the vestibulocochlear nerve, that will here the vestibulocochlear nerve, that will enter into the pons, into the dorsal and ventral cochlear nuclei through the pontomedullary junction, lateral part of the pontomedullary junction. So here you can see that the vestibulocochlear nerve on both sides, that is the vestibular nerve and the cochlear nerve, they are entering into the pons at the pontomedullary junction, This is the 6th nerve, this is the 7th nerve, this is the 8th nerve. Okay, now they will go and they will relay into the ventral cochlear nuclei as well as into the dorsal cochlear nucleus. Okay. Now so suppose this is the ventral cochlear nucleus ventrally, and this is the dorsal cochlear nucleus dorsally. So this is the cochlear nerve, this is the vestibular nerve. Okay, this is the vestibular nerve. So this is the cochlear nerve. So cochlear nerve enters into the ventral cochlear nucleus as well as in the dorsal cochlear nucleus. They relay there. After relaying, they will come out. So most of these fibers, they will come out from the ventral cochlear nucleus, and they relay in the superior olivary nucleus, very small nucleus, that is the superior olivary nucleus. Then some from the dorsal cochlear nuclei also, some fibers, they are coming and they relay into the same-sided superior olivary nucleus. Some dorsal cochlear nucleus, they will go to the opposite side and they will relay into the opposite sided olivary cochlear nucleus. Now superior olivary nucleus. Sorry. Now, ventral cochlear nucleus, some fibers they relay in the ipsilateral side, some fibers go to the opposite side. Okay. So, the superior olivary nucleus, so the fibers which are coming from the ventral cochlear nucleus, they are known as the ventral acoustic stria. The fibers which are going through the dorsal cochlear nucleus, they are known as dorsal acoustic stria. Some fibers, they again join the ventral fibers, so that is known as the intermediate acoustic stria. So there are three acoustic stria: ventral, intermediate and dorsal acoustic stria. So you can see that the superior olivary nucleus, they receive the fibers from the same side as well as the fibers from the opposite side. Okay, so superior olivary nucleus, they are getting the fibers from the same side as well as from the opposite side. And these fibers, when they cross in the midline, they will form the trapezoid body. After relaying into the superior olivary nucleus, these fibers, they ascend up and they will form the lateral lemniscus, LL. Okay, so the primary fibers here is the cochlear nerve fibers. The stria, these are the secondary auditory fibers. After relaying into the into the olivary nucleus, after relaying, these fibers will go up as the lateral lemniscus, and that is known as the tertiary auditory fibers. Okay, here you can see this is the lateral lemniscus. As this lateral lemniscus go up, there are also some scattered nuclei. They are present in between the fibers of the lateral lemniscus, and that is known as the nuclei of the lateral lemniscus. Ultimately, they will enter into the midbrain, and they will go to the inferior colliculus of the midbrain, where they will relay again, and again here they will cross. Again here they will cross. So the auditory fibers always are there crossing. So if there is any lesion in this auditory pathway, so there will be no deafness. Okay, there may be slight diminishing effect, but there will be no deafness. Ultimately, from the inferior colliculus, these fibers, auditory fibers, will go to the medial geniculate body, that is a part of the metathalamus, and from there they will go to the auditory cortex. Where that is present? That is present in the temporal lobe. There are some two superior temporal gyrus over the superior temporal gyrus there are some transverse temporal gyrus, so they are present there, and the area number, that is the area number 41 and 42. So here I have written that when there is any unilateral damage, if there is bilateral damage, then there will be deafness, but in case of any unilateral damage, there will be no deafness in either ear, because there are always crossing, they are crossing. So if they are not getting the sound sensation from one side, they will get it from the opposite side. So there will be no deafness. Okay. Now, this is the ascending auditory pathway, that is the sound sensation is going up to the cortex, whereas some fibers are coming from the cortex, and that is known as the descending auditory pathway. What is their function? They will inhibit, they will give a negative feedback to the cochlea. So what is that? So one is positive, one is negative, no effect, but that not like that. Okay, when we are in a noisy area, then we can hear many sound, but we only concentrate on a particular sound, and that our brain, they know it, so they give the negative feedback, they will inhibit it. From the cortical inhibition will come, and they do not respond to the other sound wave. Okay, only to a particular sound wave. So that is known as the central auditory pathway. So they will influence their own sensation. They will influence their own sensation and modulate the quality of sound, and that is that condition, that phenomenon is known as auditory sharpening. So there are some descending negative fibers are there, and they are coming. So these are the corticogeniculate fibers, corticocollicular fibers, colliculo-olivary fibers. So there are so many fibers. Okay, you don't have to remember all these names. Only they are coming from the cortex. Also they are coming from the only they are some fibers are coming from the colliculus, inferior colliculus, some fibers directly from the superior olivary nucleus to the organ of Corti. Okay. Now what is the arterial supply of pons? Now the arterial supply, I have already told that there is the basilar artery which is formed by the union of the vertebral artery, and that give many transverse branches, that is the Pontine artery. Also below it gives to the internal ear artery, that is the labyrinthine artery. Above it gives the superior surface of the cerebellum. From there also some arteries also supply the pons, that is the superior cerebellar artery, and ultimately the basilar artery divides into to supply the posterior aspect of the cerebrum. So that is the posterior cerebral artery. So mainly the Pontine artery. So Pontine artery also gives a branch that supplies the medial part of the pons, that is known as the paramedian branch, and as it goes laterally, it also gives a branch which supplies the lateral side of the pons, that is the short circumferential branch, and the long circumferential branch supply the dorsal aspect of the pons. Now if there is any hemorrhage or any obstruction, thrombosis, whatever, if there is any injury or any insult to this vascular supply, then the condition is known as CVA pons, cerebrovascular accident pons, isn't it? So that is known as the CVA pons. Now this CVA pons is very dangerous. If the whole pons is affected, then what will happen? That condition is known as locked-in syndrome, because in that case it is a very severe case, but it occurs very rarely. 80% cases that doesn't happen, but in some percentage cases it may happen, and that is known as the locked-in syndrome. So here the patient is paralyzed. All these muscles are paralyzed except the eye muscles, so they can move their eyes. Only one nuclei is present to supply that is the lateral rectus, that may not be effective, but the other muscles, they are supplied by the third and fourth nerve that is present in the midbrain, so they can move their eye, and they can also hear, okay. So, and their cognition sense is also there. They can recognize everybody, and they can understand that what is happening in the surrounding, okay. But they cannot move, they cannot speak also, the facial nerve nucleus has gone and they cannot speak. So that condition is known as the locked-in syndrome. Okay. But it is very rare condition, so don't worry. Then you come to the other syndrome. There are so many types of syndrome, but I will tell you only some of them, okay, only 4 of them. So there are so many, 1, 2, 3, 4, 5, 6, 7, 8, only half of them, okay. So one syndrome that is known as the medial inferior Pontine syndrome and ventral Pontine syndrome, but the two persons they described this syndrome. So one is the Foville syndrome, one is the Maillard-Goubert syndrome. So here in both cases the same thing will happen. So here the paramedian branches that will be affected. So when the paramedian branches will be affected, there will be ischemia in the medial region. So which fibers are affected? 6th nerve nucleus, 7th nerve nucleus they have not shown. We were in the medial inferior Pontine syndrome. So what structures are affected here? You can see that is the 6th, that is the medial longitudinal fasciculus, the abducent nerve. They have not shown the 7th nerve, but the 7th nerve may also be affected because it is very close. It is close to the midline also, and the medial lemniscus is affected. The corticospinal fibers are affected. So what will happen if the corticospinal fibers are affected? Then there will be contralateral hemiplegia. It is known as upper motor neuron type of lesion. Do you know what is upper motor neuron and lower motor neuron?
In physiology, they taught us little
Okay,
bit.
okay. Then you know. Okay, okay. Thank you. So this is upper motor neuron type of lesion, and this is crossed. Means if there is right-sided paralysis, there will be left-sided hemiplegia. Similarly, if this medial lemniscus, which is carrying the vibration sense, the fine touch sense, the 2-point discrimination sense, all the proprioceptive senses from the lower limb and upper limb. So these fibers, they are also crossed fibers. So there will be opposite sided loss of sensation, loss of proprioception, vibration, these senses on the opposite side. That is, if that is right sided paralysis, left side. Similarly, the abducent nerve has gone, so there will be lateral gauge palsy or horizontal gauge palsy. Here it is affected, so they cannot abduct this one. But then the opposite side, it is normal, so the medial rectus will move. Okay, when we try look to the one side, the one-sided lateral side and the other-sided medial rectus will move. So medial rectus is moving. So that is known as the horizontal gauge palsy. Similarly, on the right side, on the same side, there is the facial nerve palsy. That is lower motor neuron type of palsy. This is also lower motor neuron type of palsy. But this side, this is normal. So this side will pull the what is that? Angle of the mouth or the nose. Okay, so these are the right-sided facial nerve palsy. So that occurs either in the Foville syndrome or in the what is that syndrome? Another syndrome is there, ventral Pontine syndrome or Maillard-Goubert syndrome. Okay. Now, the lateral inferior Pontine syndrome, that is also known as the Merry-Foix syndrome. Now, here the lateral structures are affected. So, here the abducent nerve is not affected, but facial nerve, they have shown that the facial nerve has been affected, but it may not be affected also. Vestibular nuclei, cochlear nuclei will be affected. Trigeminal nucleus and its tract will be affected. And what is this? The lateral spinothalamic tract will be affected, but there is no corticospinal tract, or the medial lemniscus will not be affected. Medial longitudinal fasciculus will also not be affected. If the medial longitudinal fasciculus is affected, there is intranuclear ophthalmoplegia occurs. Okay, later on. Now here, which blood vessels are affected? That is the circumferential branch. Lateral circumferential branches are affected. So here, because of this vestibular and cochlear nuclei, they are affected. So there will be vestibular nuclei, vertigo and nystagmus will be there, and also there will be hearing loss. But that hearing loss is very minimal, partial. Sensory nucleus of trigeminal nerve is affected, so loss of pain and temperature from the ipsilateral phase. Motor nucleus, if involved, then there will be ipsilateral facial palsy. Spinothalamic tract lateral side or the spinal lemniscus, if it is involved, then there will be contralateral loss of, because they are crossed lemniscus. So if the lateral spinothalamic tract, that is same side, that is also opposite side, and the lemniscus also opposite side, spinal lemniscus. So there will be contralateral loss of pain and temperature and also pressure sensation, because medial spinothalamic tract also go through the anterior spinothalamic tract also go through the spinal lemniscus, if the lemniscus is affected. Okay, cerebellar tract that is the inferior cerebellar peduncle, that is on the lateral side of the tegmentum, it is present. So there will be limb ataxia. Now come to the upper part of the pons is affected. Then what will be affected? These are the structures will be affected. The corticospinal fibers, the medial lemniscus, that is the, what is this? This is the Pontine nuclei, and the pontocerebellar fibers are affected, and also the medial lemniscus will be affected. The central tegmental tract, which is that may also be affected, and medial longitudinal fasciculus will be affected. So because of that corticospinal tract, there will be contralateral hemiplegia. Because of the medial lemniscus, there will be contralateral loss of touch, vibration and position sense, and what is position means proprioceptive senses. And if the central tegmental tract is affected, then there will be spasm in the palatal muscle, pharyngeal muscle or laryngeal muscle, mainly in the palatal muscle. why I don't know, palatal myoclonus. It is known as palatal myoclonus. And if the this medial longitudinal fasciculus is affected, that is known as internuclear ophthalmoplegia. In that case, the adduction will be affected. I don't know how it is affected because they are connected. All the cranial nerve nuclei, particularly the nuclei which are related to the to the eye muscles, they are connected with each other, and also with the vestibular nuclei, they are connected with each other. So these fibers, there will be internuclear ophthalmoplegia. Then if it happens in the upper part, that is also in the upper part, it gives the superior cerebellar artery. So it is also known as the syndrome of the superior cerebellar artery, or the superior cerebellar artery syndrome. So here the lateral lemniscus is affected. So there will be partial hearing loss because they are always crossing fibers are there. And spinal lemniscus is affected. So there will be contralateral loss of pain and temperature and pressure sensation. And trigeminal, it is more towards the medial side, but if it affected, then there will be temperature, pain and temperature and pressure sensation on the opposite sided face is lost. And on the cerebellar fibers, that is here the superior cerebellar peduncle is there, so that is going to the cerebellum. So that is the cerebellar fibers are affected. So that's why there will be ataxia. Now I am telling you if it is okay. Is there any question?
Ma'am.
Okay. Okay.
Thank you, ma'am.
Happy Puja.
Happy
Puja,
Puja,
ma'am.
ma'am.
Okay, thank you.
Thank you, ma'am.
Thank you, ma'am.